All right, so today we're going to assess the respiratory system. I can see by looking at my patient that she's got a calm, relaxed expression. She's got good color. There's no cyanosis. She's alert. She's awake. Hi, Liz. Hi. So she can respond to me. Next, we can look. Well, her neck looks good. So we see, neck is supple. There's no areas of concern on the neck. And when we look at the arms, we can see that they're warm, they're dry, skin is intact, and the hair is all even. Next, we'll look at the fingers. So we'll look at capillary refill, which under the nail polish we can see. We've got a good capillary refill that looks like it's under 1 second. Next, if I just listen to Liz, I can hear that she's breathing audibly. If I listen closely, her breathing isn't labored. I don't see any retractions, any nasal flaring, anything of any concern. So next I'll measure her anterior posterior diameter to her transverse diameter to make sure she doesn't have a barrel chest. So if we measure here, and we measure this way, we get almost exactly a 2-to-1 ratio, which is what's normal for an adult. So this is a good finding. Now I'm just gonna feel her back. Ask if there are any areas of tenderness. Does that hurt at all? Nope. Okay. I don't feel any nodules, tumors, or any areas of concern on the back. The chest appears to be symmetric, and like she said, there's no tenderness. So next I'll assess her thoracic expansion. So I'm gonna put 2 fingers right at T10, and I'll have you just take a nice deep breath for me. All right, so we can feel that the breath is symmetric and the lungs inflate evenly, so that's good. Now I'm going to assess for tactile firmness. So here, I'll just say where you're sitting. And using the pads of my hands, I'm going to have the patient say 99 each time I put my hands down, just feeling for vibrations. So go ahead, say 99, 99, 99, 99, 99, 99, 99, 99. All right, so what I can feel there is that when she says 99 through the lung fields, it decreases as we get down out of the lung fields and more vibrations are heard through the lung fields. So that's a normal finding. Next, I'm going to ask you to give yourself a big bear hug, and I'm just going to percuss down. All right, and I would also do that on the anterior portion. And so we find that there's resonance throughout the lungs, and then dullness begins when we get out of the lung fields. So next we're going to assess diaphragmatic excursion. You can stop giving yourself that big bear hug. What I'm going to have you do is take a deep breath in and then all the way out. You hold it. Okay, so I'm just gonna want to grab that tape for me. I'm gonna place a little piece of tape. Okay. And now I'm gonna have you do the same thing, but take a deep breath in and hold it. Okay, I'll take another piece of tape. All right, you can let it go. Okay, so I'm gonna measure this, and when we measure, we see that we're about 4 centimeters on the other side. So next I'm going to auscultate the lungs, which we do posterior, anteriorly, and laterally. So I'm going to listen while you take good deep breaths in for me. All right, deep breath. And again. 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 And again. And again. And again. And again. All right, so as I said, we'd also do this anteriorly, and lung sounds are clear with good equal air movement. Bilaterally, no adventitious lung sounds are noted. I'm also going to listen. I'm going to have you just say hello so I can hear how sound is transmitted. Just go ahead and say hello for me. Hello. 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 Okay, and we can hear the lung sounds are transmitted well through the lung fields. All right. So next we're going to move on to our cardiovascular system. In the respiratory assessment, we saw that the patient has a good general healthy appearance and normal breathing effort. So next, here I'm just going to have you lay down here at a semi-Fowler's position, and I'm going to listen to the apical heart, and I would do that for a full 60 seconds. And then I'm going to take a blood pressure on each arm bilaterally. I'm just going to listen. All right, so we would do that for a full 60 seconds. And then I'm going to go ahead and take a blood pressure, and we would be doing this on both arms bilaterally. There we go. You're such a good patient, aren't you? All right, we're 110/68 on this arm, which is excellent. And then we go ahead and do that on the other arm as well. All right. So like I said, the patient has a good general appearance. Skin is pink, warm, and dry. If you turn your head to the side, take a look at the carotid. You can just see a slight pulsation there. If we look here, I'm going to lay flatter. If we look here at the apical, we don't see any pulsation, which is fine. And I don't see any lifting or heaving. Now I'm going to listen to the carotid for amplitude, rhythm, and grade, and also listening for any bruits. All right, which is all within normal limits. So next I'm going to palpate. Next I'm going to have you just turn your head slightly. We'll sit here at about a 35-degree angle and assess for any jugular venous distension, which is very clear that Liz doesn't have any jugular venous distension. And now I'm going to palpate the areas of the heart. We'll start with the apical here at the second intercostal space to the right of the sternal border. Then the pulmonary, which is to the left of the sternal border at the second intercostal space. Then we go to Erb's point, then we go to the mitral, and then to the apical or aortic. And not feeling any issues in that area. Then I'll use the pad in my hands to feel in all these areas as well, feeling for any vibrations, and I'm not feeling any vibrations. So now I'm going to listen to the heart in the same order for S1, S2 sounds. All right, and what I found there is that S2 is louder in the aortic and pulmonic areas, and then as we move down to Erb's, it's about even. The lub dub is heard about the same, and then down here, tricuspid and mitral, we hear that S1 is louder. Now I'll use the Bellamite stethoscope to listen for low-pitched murmurs, S3, S4. Which are not present. So finally, we're going to assess the patient's peripheral vascular system. So here, I'll sit you up, Liz, so you're not like way back there. So we can look at good general appearance. Skin is pink, warm, and dry. If we want to assess turgor, we see that the skin has an instant recoil, good even hair distribution on upper extremities bilaterally. Cap refill we already assessed to see that it's less than 1 second. If we look down here at the lower extremities, we see that we've got good even hair distribution. The skin is pink, warm, and dry, intact. We don't have any varicose veins or spider veins. And then, you want to take your shoe off for me? So we'll assess capillary refill on the toes here. So we see that the capillary refill is less than 1 second down here as well. And then I've already palpated for the femoral pulse, so we know the femoral pulse is good. I'll palpate, we're palpating here for the popliteal. And next I'm going to do the posterior tibialis pulse here inside the medial aspect of the ankle, which is nice and strong, grade 2. And then the dorsalis pedis pulse here on the top of the foot, which is within normal limits as well.